Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. In this video, we are going to talk about disorders of the parathyroid gland. So this include hypoparathyroidism and hyperparathyroidism. Let's start with hypoparathyroidism. So there are 4 parathyroid glands. They are right next to the thyroid gland. And the parathyroid glands release PTH, which causes an increase in calcium levels in the bloodstream in various ways, which are, it causes an increased reabsorption of calcium in the kidneys and an increased absorption of calcium in the intestines. And lastly, it pulls calcium out of the bones into the bloodstream. With hypoparathyroidism, we have a decreased or insufficient secretion of PTH, and this causes a drop of calcium level. The main causes of this could be thyroidectomy, which is the removal of the thyroid gland, which is also one of the signs that we normally check after a thyroidectomy. Hypocalcemia, right? You could either get a nick or a damage to it. So signs and symptoms include hypocalcemia, and the signs of hypocalcemia are numbness and tingling, positive Chauvisky signs, positive Trovorsky sign, tetany, seizures. There's a possibility of dysrhythmias and muscle cramps. The labs, you're going to note a decrease in PTH. The patient will have hypocalcemia, which is calcium levels below 9, hyperphosphatemia as well. Treatment. Patient will be given calcium gluconate, which helps elevate the calcium level, calcium and vitamin D, because remember vitamin D allows for the absorption of calcium, and phosphate binders to decrease the phosphorus levels. Nursing care. Implement seizure precautions. Some of the seizure precautions include padding the side of the bed, having oxygen equipment next to the bed of the patient, as well as a suction machine, right? Always have the bed at the lower setting to avoid when they have a seizure occurrence, they would not fall from a high level. It will be right next to the floor. And also sometimes they put padding on the floor in case there's a fall due to seizure. Provide patient with a high calcium, low phosphorus diet, and also give the patient phosphate binders to decrease that hyperphosphatemia. Okay? Hyperparathyroidism. So hyperparathyroidism, this is where we have an excess secretion of the PTH from the parathyroid gland. This could be either due to a primary or a secondary cause. So with a primary cause, patient could have an adenoma, which is a benign tumor on the parathyroid gland that causes excess secretion of PTH. With a secondary cause, the patient could have either a kidney disease or kidney failure. Due to the kidney disease or kidney failure, there will be hypocalcemia. Remember, there's the absorption of calcium in the kidney. So if the kidney is not functioning well, we might have low absorption of that calcium, so which will lead to hypocalcemia. And the parathyroid glands will sense the low calcium levels and they will start pumping up calcium to elevate the calcium to compensate for what the kidneys is not doing, right? And since the kidneys is not absorbing it, there will be also still elevated levels. So labs, you'll have high levels of PTH, high levels of calcium, and low levels of phosphorus. Signs and symptoms. Some of the signs and symptoms of hypercalcemia, because remember hyperparathyroidism leads to hypercalcemia, and signs of hypercalcemia include muscle weakness, bone pain and deformities, fatigue, nausea, vomiting, weight loss, constipation, hypertension, kidney stones, and dysrhythmias. Treatment. Lasix, which helps reduce the calcium level through excretion. Calcitonin, which helps to bring down or tone down calcium levels in the bloodstream. Administer phosphate to increase the phosphorus levels. Surgery may be needed if the patient has an adenoma, which is a parathyroidectomy, which is the removal of the parathyroid gland. Nursing care. Implement safety precautions due to weak, fragile bones, right? Provide patient with low calcium, high phosphorus diet, and increase fluid intake to help prevent the constipation and the risk of kidney stones. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.